Rebounding from the ongoing pandemic will never be fully possible. Since last March, Michigan has lost nearly 18,000 people to COVID-19. Earlier this year, the virus was the #1 cause of death in America. According to the Kaiser Family Foundation, the U.S. averaged over 2,400 deaths each day from COVID in February. That's 20% higher than heart disease, which is typically the country's leading cause of death. Tuesday, the U.S. marked fewer than 1,000 lives lost to the virus. And that progress comes as a result of nearly 150 million Americans who've received at least one dose of the vaccine, along with better treatment for COVID-19. But that treatment is expensive. And an increasing number of insurance companies who once voluntarily waived fees for treating COVID are quietly getting rid of those waivers, leaving COVID patients trying to navigate both a physical and financial rebound. Matthew Crawford got his first Moderna shot April 8th, and his symptoms were pretty typical.
And then all of a sudden, like the literal list of all the side effects of the drug, which was like the chills, the fever, body aches, like all of that set in.
The Pinckney resident thought he was reacting to the vaccine, but a week later, the side effects were still there.
And then my wife, who is brilliant, said, go to the doctor. Like, we have insurance, go to the doctor.
Turns out Matthew contracted COVID in the week before he got the vaccine. He's slowly getting better now, but still, he's being treated for blood clots in his leg and chronic pain. Treatment for COVID patients like Matthew can add up. Federal law requires COVID tests to be free of charge, but health insurance companies voluntarily waived fees like copays, deductibles, and coinsurance until now.
They voluntarily waived certain aspects of COVID fees at the start of the pandemic in March 2020, and now we're seeing them voluntarily roll them back.
Anne-Marie Kelly teaches healthcare law and policy at Eastern Michigan. She says insurers are well within their rights to reassess fees for treatment, and that includes other aspects of coronavirus screening like x-rays, blood tests, and blood cell counts.
Even if you have employer-sponsored coverage through yourself, your spouse, your parent, if you're under 25, it could be thousands of dollars out of pocket.
Well, big insurers like Aetna, United Health, and Anthem are among the companies rolling back waivers. Kelly says the waivers were always designed to be temporary, and they were rolled out for goodwill and great PR.
It could be seen as certainly unfriendly, but even unpatriotic if you were to charge someone high copays or other deductible fees during a pandemic.
It was also smart from a legal standpoint. Federal law wasn't changed to require the waivers because the companies were already doing it. The move encouraged Americans to get tested and be treated, and no doubt saved lives.
1 minute I was perfectly healthy. The next I'm being taken in an ambulance to the hospital because I'm so sick.
Sarah Boucher is expecting her second child. She came down with COVID and landed in the ICU at Henry Ford Hospital, followed by a stay in labor and delivery so doctors and nurses could watch her baby.
Have you received any bills yet?
I have not. No ambulance bills, no medical bills yet. I keep checking. I have really good insurance, so I'm assuming it's not going to be anything crazy.
Blue Cross Blue Shield of Michigan and Blue Care Network account for roughly 40% of the state's healthcare insurance market. Nearly 250,000 members have had COVID treatment fees waived, and the company says they put more than $1.5 billion into responding to the COVID crisis. The companies are still waiving fees for COVID treatment until September, according to Blue Cross Blue Shield Chief Medical Officer Dr. Jim Grant.
It's the right thing to do for our members. We're all going through a lot of stress with COVID. Our members, our customers, our providers, our community.
But one by one, all companies will roll back these waivers at some point. To avoid a surprise, look out for notices of changes to your policy. And Dr. Grant says, get vaccinated so you don't get sick. Now, I checked with Priority Health, Michigan's third largest health insurer, and they're also waiving fees till the end of September. And Dr. Kelly from EMU says it's good business. Any company appearing to take advantage of people during the pandemic will only make it harder for that company to attract new customers and hold on to the customers they have when re-enrollment comes around.